Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined today by Lanette Siragusa, Chief Nursing Officer and Provincial Lead of Health System Integration and Quality for Shared Health. Today, changes to the pandemic response system came into effect. The Interlake Eastern and Southern Health and Prairie Mountain Health regions have moved to the restricted or orange level on the pandemic response system. This means that every region in the province, with the exception of the Winnipeg metropolitan region, are now at restricted level orange. The second move takes Winnipeg metropolitan region to the critical or red level on the pandemic response system. We know that this offers a lot of challenges for Manitobans, especially business owners, but we're at a very critical juncture right now. With our case numbers climbing, we need to make dramatic changes to our activities to reduce the amount of transmission of this virus. The idea behind these orders are to reduce interactions of Manitobans outside the household, to reduce opportunities for Manitobans to gather in larger groups, to reduce the opportunities for gathering in larger groups with prolonged contact in indoor places. All to reduce the number of contacts we have. And we know we're at this critical juncture where we need to make these changes, and we need to make them now to ensure transmission of this virus is reduced, to ensure that our healthcare capacity is not exceeded. We know in all of these areas that we put further restrictions on, we've seen outbreaks linked to them. We've seen transmission occurring in them, and so by taking these further actions, we're going to be reducing those opportunities for outbreaks and transmission. It is essential for us to address these case numbers. I want to talk about self-isolation and our approach moving forward, especially in this critical area in the Winnipeg metropolitan region, especially for these upcoming weeks. We've seen a lot of transmission of COVID. We see this transmission in the community. And so at this point in time, anyone who is symptomatic or has a household member who is symptomatic should all self-isolate pending results. And so this is a significant change. This is a change in the short term. This is a change that we need to make now to really stop the transmission of this virus. So again, if a family has a child at home with symptoms of COVID, that entire family is to self-isolate pending results of that test. So it means no one else goes to school, no one goes to work until that test result is back. If the test result is negative, then of course anyone who's not having symptoms will not need to self-isolate any further. We know that this will lead to a lot of absenteeism. Again, it's in keeping with our message that people should be staying home for the most part. Because of this, we need to exempt our healthcare workers from this. We need to maintain the capacity in our healthcare system. First responders would be exempted from this. There could be other critical or essential workers that could be exempted from this, and examples would include those in, say, Department of Families that are working in group homes, etc., where staffing would be an issue. But for the most part, anyone is sick in a household, that entire household will self-isolate pending results of the COVID test. We're going to talk again about what self-isolation means. When somebody is identified as a contact of a case and is advised to self-isolate, the real purpose of that is that should that person become a case, they would have zero contacts because they should be self-isolating from all others during that time. What we find is that the manner and mechanism of self-isolation is not achieving that. That many household members are also becoming cases because that person is unable to successfully self-isolate from others. And so this can be difficult in a lot of situations. We do have availability of alternate isolation accommodations for people who are unable to self-isolate within their home, but that self-isolation means staying away from other people in the household. If you're symptomatic, staying in your own room, using your own washroom, if that's unable to do that, to ensure proper sanitation. But what we don't want is that everyone in that house be exposed unnecessarily to somebody who should be self-isolating, and we see that again and again. So we have those two messages, that anyone at home right now is symptomatic with signs or symptoms of COVID, that whole household should self-isolate pending results. If you are advised by public health that you are contact, or a case to self-isolate, that means self-isolating from all other members of your family. Certainly with children, there'll need to be one parent designated as a caregiver, but not both and not everyone else in the family. We need to limit our contacts even within our household. Now, this change will definitely lead to a lot of absenteeism, but it's going to be short-term. It's going to help us shift gears with the transmission of this virus, but we need everyone on board for this short period of time to change these dynamics that we're seeing right now. So again, these overall, we need to reduce our contacts outside our household, stay home for the most part, practice those fundamentals, hand washing, physical distancing when you're out, leaving your home for essential purposes, for shopping, groceries, etc. Try to send only one member of the household out. And when they're out, they'll be practicing those fundamentals. So we have the immediate time. This week, next week, we need to shift the dynamics of this transmission. And we all can. We've done it before. And we need to buckle down right now for these next couple weeks to really shift things up. Today, we are reporting 5 additional deaths. A female in her 50s from the Winnipeg Health Region, a female in her 60s from the Winnipeg Health Region, and this is related to an outbreak at St. Boniface Hospital, a female in her 70s from the Winnipeg Health Region related to an outbreak at Parkview Place, a female in her 80s from the Winnipeg Health Region related to an outbreak at Simpkin Center, a female in her 90s from the Winnipeg Health Region related to an outbreak at Maples Personal Care Home. I'd like to extend my condolences to these families and their loved ones, as well as the families of the individuals whose deaths were announced since Friday. Our current 5-day COVID-19 test positivity rate is 9%. 241 new cases of the virus have been identified as of 9:30 this a.m., bringing our total number of lab-confirmed cases in Manitoba to 6,275. I can provide some outbreak updates. Parkview Place, total cases 138 with 106 residents and 23 deaths. Maples Personal Care Home, 146 total cases, 117 residents with 6 deaths. Victoria General Units, 5N and 5S, 45 total cases, 21 patients, 1 death. Headingley Correctional Center, 44 total with 34 inmates, 0 deaths. So again, our numbers are trending in the wrong direction and trending at a rate that we cannot sustain. We needed to make major changes, and that's why the pandemic response system has been changed province-wide to restricted and critical in the Winnipeg metropolitan region. And we know this is very challenging to Manitobans, challenging to business owners, but we have to see this as a short-term response to a very concerning situation. We need to bring these numbers down. We need to be able to maintain the capacity of our healthcare system. We've also advised that anyone with a symptomatic person in that household should self-isolate pending results, and as well as reinforce the importance of proper self-isolation when advised to by public health. So again, we've seen these numbers climbing. We've heard concerns from Manitobans, concerns from healthcare providers. But certainly this is not a time to panic. This is a time where we move to our plans. We have plans in place. We have now escalated our restrictions, and now we need Manitobans to act on this advice and to follow those restrictions. We'll change our behavior at this point, and this is the short term. We won't be here forever, but we need to be here right now. We need to change our behavior right now and change this viral dynamics that we're seeing. We need to reduce our contacts outside of our household. For the most part, we should be staying home, less socializing, sending only one person from our household out to do essential tasks. Reduce crowding, reduce indoor, poorly ventilated places, keeping those group sizes down. And again, just like in our first wave, we'll get through this together, but we're not going to panic. We're going to fall back on our plans, fall back on what we did in the first wave, and then we'll be getting through this together. So again, thanks to everyone. I'll turn it over to Lanette.
Thank you very much. Good afternoon, everyone. So last week we informed you that we would be flexing up health system capacity in preparation for the anticipated patient surge we're expecting to see in acute care in the coming days and weeks. That work has begun. Over the past couple of days, we have added 3 ICU beds in Winnipeg over the weekend, combined with adding 6 beds that are available in Brandon. So for those who are keeping track of our numbers, last week we reported based on 71 critical care beds. From now on, well, until the future, right now our baseline is 80 critical care beds that are open within the province. We have also begun preparing for a number of other spaces that can be converted to critical care beds throughout the system, including special care units and step-down units. As of 9:10 this morning, our ICU capacity was at 94%. 75 of the 80 beds were in use at that time, with 18 of those beds being occupied by COVID-19 patients. 11 COVID patients are on ventilators. And as a reminder, the number of people in our ICUs are really a snapshot in time that will change throughout the day, sometimes by the hour. But that's a sense of where we're at since over the weekend. I can also provide a weekly update on the number of positive cases involving healthcare workers. In the past week, 50 healthcare workers across the province tested positive for COVID-19. 1,600 healthcare workers were tested in this past week. The 50 positive tests include 48 from the Winnipeg Regional Health Authority, 2 from Southern Health, and 0 in Interlake Eastern, Prairie Mountain Health, and the Northern Regional Health Authority. Broken down by profession, this past week's numbers include 12 nurses, 26 allied health professionals, and 12 others who have not yet been identified. Since the beginning of the pandemic, 285 healthcare workers have tested positive for COVID-19, and 24,166 tests of healthcare workers and first responders have been completed since the start of the pandemic. Meanwhile, our provincial surgery team has worked throughout the weekend to further develop details on the plans to gradually slow down elective and non-urgent surgeries. The elective and non-urgent surgical and diagnostic activity will be decreased over the coming days in proportion to the escalating needs that we expect to see in medicine and critical care. So at this point in time, leadership are managing at a local site level to determine where staff need to be redeployed based on the current and immediate demands on the healthcare facilities. As we have shared previously, slowing down surgeries and procedures or health services of any kind is never our first choice. However, it is an initiative that can result in a rapid creation of space, beds, and staffing that can be diverted to other areas of urgent need. This plan will be based on individual patient need and urgency of the situation, as well as the local site's current capacity. As we said on Friday, urgent and emergent procedures will continue, and a reminder to patients that you will be contacted directly if your procedure is postponed. If you are not contacted, then you should assume that your surgery is proceeding as planned. So I just want to talk a little bit about the preparations that we're doing. So by decreasing non-urgent and elective surgeries and other procedures, we can quickly free up those beds across the system when we need to. We can also free up the staff if and when we need to redeploy them. This will be in conversation with our clinical leadership, with our regulatory bodies, but also most importantly with our employees to have a conversation about what their skill sets are, their competencies, and how that matches with the patient needs. Some training and orientation has already occurred in the spring, and more is being organized for people who may have to move to medicine and critical care. We are continuing to process the applications that we are receiving from retired healthcare workers, part-time healthcare workers who want to pick up extra shifts or work in a different environment, and students who are training in the healthcare field. So on behalf of my team, our team, I want to express sincere appreciation to everyone for their contributions and commitment. We'll be reviewing these detailed plans over the next couple of days with the leaders and the regulators and the staff as soon as possible, and we will continue to keep the public informed on our progress as we go. And with that, we can open up the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary and two follow-up questions this afternoon. Up first from CHVN, Taylor.
Hi, good afternoon. Now, you've been talking about how it's a minority of people who aren't following these rules. Why do you think some people aren't listening to the gathering size restriction rules?
You know, it's hard to comment on why certain people are doing things. There are certainly thoughts that this is challenging times. This pandemic has been around now 8-9 months, and some people are getting tired of the restrictions. Some people are losing focus on how severe this can be. And we can now see that severity translating into hospital admissions, ICU admissions, unfortunately deaths. So we just have to get back on track. We need everyone on the same page with this. And we have restrictions in place. We have the parameters in place right now to make real quick changes. To see relatively quickly some changes in this virus transmission, but we need to act now. We're at that critical juncture right now where it's time we all need to act.
And there are going to be a lot more isolating households soon. How do families get help for things that they may need, like medications or doing laundry?
That's right. So, I think that in the summer, we advise people to prepare for absenteeism, to prepare plans for the need to self-isolate. So hopefully we've made some plans for that. And again, you're right, we expect in the short term, in these next couple of weeks, there will be many more households requiring self-isolation. And so there certainly isn't a need to panic buy, right? There's no need to panic, right? We have plans in place. We have these restrictions in place. We're going to see these numbers start coming down as long as we get people on board.
Thank you.
From the Winnipeg Sun, Scott.
Good afternoon to you both. Scott Billick here, Winnipeg Sun. Dr. Roussin, you went over several numbers there about UCH numbers, about hospital numbers and stuff like that. When are we going to get that stuff on a daily basis so we don't have to keep asking or every second day to try and find out these numbers? And when is our dashboard going to become far more robust, like the ones you see maybe in Ottawa or in Atlantic, Canada?
Yeah, I don't know about the numbers being reported. There's people, in our epidemiology that are working on reports like that. So we'll have to see when that is. And then you mentioned robust. I'm not sure what sort of indicators did you feel were missing, or information that's missing on our reports?
Well, I mean, I'd encourage you to maybe look then at the Ottawa Public Health Authority dashboard. There's a ton of information. And I guess the question is, why do we have to wait so long to get this information? Like, even the Victoria Hospital numbers that you've suggested today are different than the ones that were posted on Friday. And the ones that are posted on Friday suggest 58 cases in Victoria General Hospital. And I think you said there's only 44 there today. So there's just a lot of discrepancies and confusion among people, and I think that leads to fear among people.
Yeah, and so I think we can work on trying to get those numbers updated. I think there's lots of moving parts on these, and again, remember the reporting of the numbers is not the work, right? The work of the contact investigation, the outbreak management from infection prevention and control, that's happening in real time. This is just a roundup of the numbers that get reported. So I agree. We'll be accurate. We'll try to get those numbers to you, but this is not reflective of the work that's the actual public health work that's getting done.
All right, thanks for that. My second follow-up, or my third follow-up, is how many former nurses and other healthcare workers now have been hired back through your recruitment efforts, and how many of them have been maybe placed in seniors' homes currently experiencing outbreaks?
You know what, Scott, I can get a better breakdown. I didn't get one for this day, but I will get that for Wednesday for you.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin, Gavin from Radio Canada. How do you feel about the effectiveness of a possible curfew, an idea that Brian Pallister floated earlier today?
Well, I think that we need to continue to get the message out about how important we are right now, what this moment is for Manitobans. And so we need everyone on board with these restrictions. We need everyone on board with decreasing their contacts outside of their household. And so, these type of travel bans for certain periods of time, can help us achieve that. So it is something to review. But the major message is that we have to do whatever we can to get the message out to Manitobans on how critical we are right now to make changes.
Could you explain some good practices for sharing a washroom with someone who's symptomatic and self-isolating in the same household?
Right, so ideally, we shouldn't be sharing that, but obviously that's not possible in all cases. So with that, it's the fundamentals we get to. So a lot of hand washing. Whenever that symptomatic person is in a place in their home that other people will be in, they should be wearing a medical mask. And then some typical disinfection, typical household products to clean that washroom quite well.
And finally, the Canadian Civil Liberties Association is contesting travel restrictions to Manitoba from the east, especially now that the caseload heavier here than it is out in Eastern Canada to a certain extent. They're asking whether you have the authority to limit freedom of movement in that way. So I was just wondering if I could get your reaction to that.
Yeah, I think that we're in a pandemic right now. Manitoba is seeing a significant increase in cases and starting to see some demand on our healthcare system. So, I think we're going to focus on doing whatever we can to reduce those numbers to ensure our healthcare system can continue to function. Those type of issues are important, and we constantly review our restrictions. But right at this point, we're focused on bringing these numbers down in Manitoba.
From CBC Manitoba, Bart.
Hi there, folks. The Premier said that Manitoba didn't do enough to ramp up contact tracing. How many people were employed were volunteering in total as contact tracers on September 2nd, October 2nd, and today?
Yeah, I don't know that answer, and we don't typically employ people as contact tracers. They're up until these last couple of weeks where we started getting the Canadian Red Cross and Statistics Canada, our contact tracers are public health capacity. So our public health nurses were doing that, and so it varied on each day who would be assigned and how much would be assigned. So we don't have people in the public health system who are just labeled as contact tracers. However, now we have implemented resources with Canada Red Cross and Statistics Canada, and we'll see those numbers start climbing. I don't have an exact number, and I certainly don't have numbers in front of me that on those dates you provided.
Okay, you can hear that. We keep asking for them. Anyway, moving on to a different topic. Forgive me here. Maple's personal care home has very high numbers now of infections. What's being done to address the staff shortages there?
So if you,
So the personal care homes are challenging to staff, and we're finding that in our recruitment and redeployment. So I know the Winnipeg Regional Health Authority is very involved with all the all the PCHs, especially the outbreak sites, and working to support them. There also is conversations about potentially looking at external sources if they could come in and support during a time where they need actually more resources with cleaning and helping patients who are sometimes confused. So we continue to work very closely with the PCHs and look for opportunities both within and beyond our provincial health system.
And still on the topic with Maples, Dr. Roussin, how can you explain this? We're finding that the majority of the people tested were asymptomatic. I mean, I know we normally get some of those, but how is it possible so many asymptomatic people are in one place?
Yeah, I mean, it's we know that there's people, when we talk about asymptomatic, it's hard to know whether that person is is asymptomatic because they were a recovered case, that they were symptomatic in the past and just not tested, and we know with our PCR tests that we can still pick up on the infection weeks later. They may be pre-symptomatic. They may have been tested and now develop symptoms afterwards. So there's a lot, embedded in that question. I don't think there's anything that's making us think there's a unique situation in that area. When we do a lot of asymptomatic testing, you're going to find asymptomatic positives.
From the Canadian Press, Kelly.
Hello, thank you so much. So the Premier mentioned earlier in the day a big DJ house party being promoted online, and we've seen the impact of sharing when you share information about large-scale spreading events. So can you give us any indication of maybe some larger events, church services, parties, anything like that, involved in these thousands of new cases?
Yeah, well, and so remember, these are, exposures from, a week, 10 days ago. And so a lot of them are tracing back to Thanksgiving gatherings. So a lot of family gatherings, a lot of friends and family gathering related to Thanksgiving is certainly that. We've seen a lot of transmission in various recreation, adult hockey, other recreation type settings. So a lot of the things that we focus these restrictions on are exactly where we started seeing those cases. So we've we know that when we start seeing those gatherings, the amount of interactions outside of the household, the prolonged contact, we're going to start seeing spread like this. And you see much more spread like this when we start seeing a positive test rate of 9%, where, when you're gathering with other people, there's much more likely a chance that somebody in that group is infectious. And then there's much more likely an event that many people will be exposed. So we really have to stop that socializing outside our household, again, for the short time, not forever, for the short time, if we want to see these numbers come down.
Last Monday, you warned that if things didn't change, we'd see 5,000 cases by the end of the week. And now that seems like a small number. We're well over 6,000 and on a fast track to 7,000. You say it's not the time to panic. When is it time to maybe have sterner messaging or panic about capacity in healthcare?
Yeah, I don't think our plans are ever going to involve panic. We have well thought out plans. These plans were very robust in the first wave. We obviously didn't need to implement them. But right now is a time for action. And these restrictions are, quite restrictive. These are the most restrictive orders we've had in place since very early in the spring, very early in the pandemic, when we knew very little about this virus. And so we've taken action. We're messaging the Manitobans that now is that time to act, that we need to change this now. And we've messaged now that, we need many more people to be self-isolating. Anyone in that household is ill because we're seeing so much COVID, you have to assume that that's COVID until proven otherwise. So you or a member of your household is ill, everyone self-isolates pending results of that test.
New data online is showing that 1/4 of ICU cases are people under 50 years old. Are you seeing any concerning trends when it comes to hospitalization, especially considering we probably won't see an increase in hospitalization for this surge in cases for another week or two?
Well, we are seeing all different ages in the hospital. Certainly the senior citizens and those with chronic diseases are the most vulnerable, but we have people in their 20s, 30s, 40s, and some teenagers as well. So it's not selective, and it can impact all of us. So we're just going to continue to watch the trends, but it doesn't matter how old you are. We're going to find the space and treat you equally well, no matter where you live or where you are.
From CTV Winnipeg, Michael.
So this is a question just about contact tracing, and thank you for taking the time out of your day to answer everything. This is regarding a lag time for contact tracing, particularly with schools. Henry G is at school. There's a 2-week lag of a possible case. A letter was only just sent out today about an exposure from October 19th. So why is there such a lag, and especially since that this will probably lead to community transmission?
Yeah, so I can't speak to that specifics. I don't know that specific case. Sometimes this lag is not anything to do with public health. So we know there's a number of people that wait many days before they get tested. So if somebody was, say, tested on a given day, but had been, we trace back their symptomatic period to 2 days before the onset of symptoms. So that can explain why the lag is. We may have got that message out within a day of receiving the positive test, just that person had been symptomatic for, say, over a week. So I can't speak specifically to that, but we have seen that what's perceived as a long delay is simply the long delay in the person being tested.
Okay, and then just kind of follow up on contact tracing itself. Dr. Roussin, do you believe that right now that you have the budget and resources for public health to conduct contact tracing and testing to adequately protect Manitobans, so that way there aren't lags in the information given and the and the alerts are given in a timely manner?
Well, we have increased that quite a bit, and I do feel that by this week we're going to have very adequate resources to contact trace based on these increased numbers. So as we saw these numbers come in very quick and many days of high numbers, there was a backlog both in the reporting out of cases as well as in the contact tracing of those cases. But we've put in steps quite quickly to relieve those backlogs, and we're even taking further steps this week to ensure we have even excess capacity.
Okay, then my last question is just involved with PPE for healthcare workers. As we're hearing reports that nurses specifically aren't receiving PPE they would want, like N95 masks, and when they do receive them, they're only given one N95 mask per day. So I guess my question is, why are nurses not getting the equipment they require? Is it because of rationing, a supply shortage, or another reason?
So we have PPE guidelines that are established based on evidence and our clinical experts' input. We've also looked at other jurisdictions throughout Canada. So those guidelines are developed depending on the unit and the patient population. If it's a COVID unit, which we call a red unit, it would be different than if it's a non-COVID unit, which is a green unit. But there's PPE established for every area in the healthcare system. I have heard that people are not getting their PPE. I have followed up on everything that I've personally received, and I think there is a lack of communication somewhere, but there is a protocol right now that every nurse should be doing a point-of-care risk assessment with their patients, and if they determine that they require more PPE, and specifically an N95 mask, then they should be getting an N95 mask. They may be questioned, and that's okay. Everybody has some accountability in the system, including keep yourself safe, but also to conserve the PPE. So a question is not a denial, but it is a question. So I will continue to follow up as any reports come to me, but I haven't, every time I follow up, then it seems to me that they are receiving it. So if there's miscommunication, certainly we want to address it. If we would involve the local hospital or wherever the facility is that person's working in, as well as infection prevention and control to ensure that people have what they need to do their jobs.
From City News, Stephanie.
Heather, Stephanie Lasuk with City News. It seems to be a couple of these hospital outbreaks linked back to patient transfers. We saw one at St. Boniface from a cardiac intensive care to the regular ICU, and one from St. Boniface to Victoria. What is being done to make sure we don't see any more hospital outbreaks linked back to patient transfers?
Yeah, the teams are looking at if there was a breakdown in communication. Also, if they were symptomatic, asymptomatic, if they were diagnosed or suspect. So they are looking at the situations that have occurred and using them as learning opportunities so that we can improve the process. And once I get that report and recommendation, I'd be happy to share it.
And we also heard about Halloween parties going on this weekend, particularly a big one in the south end of the city. Was that party ticketed? We heard there's only 3 tickets given out this past week, and the Premier wants to hand out even more. Was that particular party ticketed?
I haven't received any information on tickets given out over the weekend. You know, certainly moving forward, that's the plan is that we expect these orders to be followed, and there is that desire and ability to be offering fines for people who are not following these orders.
Okay, and then just the last question for you guys. 17 health experts have penned a letter to the Premier, to the Health Minister, saying that the healthcare system is 2 or 3 weeks behind. What's your response to that letter? Have you seen it, and what's your response to it?
I haven't seen it.
I've seen, some parts of this this letter. I mean, I think that our, we value the input of our healthcare providers, right? And healthcare providers are there for Manitobans, and like usual, they're there for us now. And we got to be there for them. And so we need to step up and reduce our contacts, reduce that demand on the healthcare system. But there is a plan in place. There's been a plan in place for quite some time to ensure we have that capacity. But certainly we are at that turning point right now where we need to ensure we change the ways we're conducting ourselves outside of our household to limit transmission, to reduce the impact on the healthcare system.
And I would also just say I haven't seen the letter, but I really appreciate healthcare workers, physicians, and others who are concerned and want to contribute to a solution. They haven't talked to me, and I look forward to being able to share more details of the plan, the team-based care, the models, how we're going to expand, and that will be happening in the next week or so through our medical and clinical leadership. And certainly we want to have feedback. We want this to be the best plan we can implement in the time that we have. But I think the more feedback we get, the better. So I haven't read it, but I will seek it out and try to connect with them and share what we have so far.
From the Winnipeg Free Press, Danielle.
Hi, and good afternoon. Dr. Roussin, my first question is for you. The University of Washington Institute for Health Metrics and Evaluation created a pandemic projection model for Manitoba that suggests that had the province maintained restriction levels prior to the most recent changes to the PRS, we might have seen as many as 1,800 deaths by January 1st. Can you comment on this projection, and is it in keeping with the province's models?
So yeah, I mean, I think that we've seen all sorts of different models presented in various forms for Manitoba, for other parts. We've often seen that the accuracy of them as things rolled out was always difficult to predict what's going to happen. I think what the issue is if we continue along our current trajectory, we're going to see excess amount of deaths. We're going to see that impact on our healthcare system. And so that's why we've implemented these further restrictions. That's why we're messaging very clearly to Manitobans that we need to change what we're doing. So it's very hard to predict, how many people would die. But what we do know is that given this trend, if we do not reverse this trend, we will see many more deaths. We will see strains on our healthcare system.
Thank you for that. And my second question is for Mr. Siragusa. Can you explain what is the shared health policy for COVID-19 testing and isolation of new admissions to personal care homes and hospitals?
I don't have it off the top of my head. But I can definitely get it and share it with you.
Okay, yeah, Yeah, that'd be great. We are trying to understand, whether a patient is tested when they come into the hospital for COVID-19 and if they're put into isolation. And I guess my follow-up to that would be, because we're seeing so much COVID in the community and we're told to assume that if, someone has any sort of symptom that should be COVID until proven otherwise, why not isolate all new hospital and PCH admissions and perhaps provide N95 masks to patient care providers as a standard practice?
Yeah, I think Dr. Roussin might be able to speak to the testing on transfer. I think that's what you're specifically asking about, like when they transfer from acute care to the PCH or back and forth.
Yeah, for sure.
Okay, yeah, we can get that information. But in terms of isolating, they certainly try to cohort. You can't always isolate just because of the physical restrictions. So that can sometimes be a challenge, although I think they would appreciate being able to do that. Cohorting sometimes is the best that can happen. And with the N95 masks, those are really mostly required for if an aerosol generating procedure is being done, so a suction, an intubation, a nebulizer, those kind of procedures where there's particles in the air. That's when the N95s are mostly used. So unless that's happening in a personal care home, and it could, but it's not necessarily N95s for everyone. The PPE that is recommended is procedure masks and goggles and gowns and gloves.
From Global, Brittany.
Good afternoon, Dr. Roussin and Ms. Siragusa. My question to you is more on the doctors. We had that original letter on Friday from 17 doctors. It's now up to 180 and dozens who are now speaking out, saying essentially that we got lucky in the spring with locking down and not seeing the cases that we saw. And they are saying the only way out of this is for another full lockdown. You have dozens of doctors and healthcare workers saying that. What is your response to them with just a partial lockdown?
Yeah, I think it's again their opinions are certainly appreciated, and I think that them speaking out is giving further credence to what we're telling Manitobans on just how critical this moment is for us, that we need to take actions right now. When we talk about the full lockdowns, these have huge implications, and again they're very difficult to necessarily get out of when you lock down so widely. We think we've learned a lot about this virus and ways to take a bit more nuanced approach rather than having to lock down everything. In saying that, we will take whatever measures we need to. But their opinions are much appreciated, and we're going to continue to work with them. And like I said, is that our healthcare workers on the front line are always there for Manitobans. Now it's our turn to be there for them, to change our actions, to reduce that strain on the healthcare system. And I think the messaging of that many healthcare providers, that many physicians, should really reinforce that message to Manitobans on just how critical these next days to weeks are.
Thank you. My next question is, are all tests that are being done in Winnipeg currently being run through Chatham Provincial Lab, or are any being outsourced to places like Ottawa or other areas?
Well, we have for testing, there's a number of areas that testing is being done. For the most part, testing is done through Chatham Provincial Lab, as well as through Dynacare.
From the Brandon Sun, Kyle.
Good morning. I asked this question to the Premier this morning, but I thought I'd just repeat it. Here in Prairie Mountain Health, we have much lower case numbers compared to the rest of the region. So what would you guys say to somebody who might suggest that the new restrictions put in place today, the orange restricted measures, are unfair, considering that we're experiencing much lower caseload compared to the rest of the province?
Well, we're well within the second wave, and you can see that in many jurisdictions in Canada and throughout the world. So we know that the trajectory is going up. And so we do want to try to get ahead of things. We know that our healthcare system is being strained, so we need to take whatever steps necessary right now to limit the strain moving forward. So it's these approaches that we take are not targeted unfairly at people. They're targeted against the virus, targeted to maintain our healthcare system. And so we are going to see in different areas some trends upwards while others are trending down. We just have to find ways, balanced ways, to try to decrease the transmission right now in Manitoba. And you can see from our numbers we're in the wrong direction, so we had to take steps. We're left with no choice but to make some big changes to the restrictions, and we're really expecting Manitobans to step up.
All right, thank you. And I know that the idea of enforcing a curfew is theoretical at this point, but how would a curfew of this nature work in more rural areas of the country where it's not as easily enforced as in in a larger metropolitan area?
Yeah, and so if it was something like this might be considered just where we have a critical level. It could be province wide. Public health will provide its advice on steps that are necessary. It's in other people's expertise on how to end up enforcing them. So, so for now, we're going to continue with public health providing advice on how best to really reduce the amount of transmission going on.
All right, thank you.
Back to Global and Brittany for one more question.
Hi, thank you. The Premier talked about a curfew today and stepping up enforcement. Dr. Roussin, in the past, you said, enforcement can have issues with stigmatization and all that. We've only seen a handful of tickets really handed out in the past 2 weeks. Is that going to be the answer to help get some of this under control? Is stepping up enforcement and actually ticketing people one of the ways we can get back to keeping those cases down?
It's certainly going to be part of our tools. Because we don't have time. We need these restrictions to be followed now, not 2 weeks from now. And so we have to get that message out. And if Manitobans are typical for how Manitobans normally step up, we may not require a lot of enforcement. We may see people stepping up now more than ever because they see the importance of this. They're hearing from my physician colleagues on how important it is right now to step up. But if enforcement's necessary, it's definitely going to be there because we need to get that message that we're at a critical point.
From CJOB, Joe.
Hi there. If we are going to be stepping up enforcement, are you concerned that we might have people lying to contact tracers as was brought up in the past?
Well, this is, we have to be careful on what we're enforcing. So if we're enforcing gatherings, enforcing places where people are gathering that are contravening the order, that's one thing. When we're trying to look at, say, an individual who is symptomatic, if there are circumstances that this person showed a disregard for the health of Manitobans, then at that individual level we may well enforce it as well. But you're right, we have to be aware of stigma. We have to be not driving things underground where people are afraid to be tested or afraid to talk about their contacts. So it is that balance, but what we're looking for is, and what we've saw is blatant disregard for the orders at points in time. And those we need to enforce, and then we need to make Manitobans aware that we will enforce them.
Gotcha. My next question is about the Southern Health region. Where are those cases coming from? Are they still linked to the poultry plant, or is there another outbreak?
Well, like most of Manitoba, we're seeing community-based transmission. So a lot of it isn't directly linked to other things. We're seeing that transmission in the community. And so this is why that message has to be so clear, is that we just need to decrease our contacts outside our household. Right? So there'll be people now who perhaps were in contact, knowingly or unknowingly, with the virus and may develop symptoms at some point. If they have reduced the number of contacts, then we're not going to see that transmission continue. And so it's just the steps we take today will really show us a benefit with that week to 10 days from now.
And I know earlier you were asked about travel restrictions going east. How about the western travel restrictions, 14-day self-isolation period? Is that in play right now?
Well, we never take things off the table. We're going to do whatever it takes to protect Manitobans. If you look at the our numbers right now, we're not seeing that our risk is from travel within to the province. Our risk right now is the community-based transmission that we have. Our cases are having too many contacts, and so that's what we're focused on right now.
From the Globe and Mail, Kelly.
Hi there. I'm wondering if I just want to make sure I understand what's happening in your ICUs correctly. So you said the baseline before this weekend was 71 beds for the whole province, if I think I heard you correctly. You're now at 75, but you've added some extra beds, including 6 in Brandon. Did you go over capacity this weekend and have to transfer any patients to Brandon because you'd run out of space in Winnipeg?
Well, first of all, 71 was just in Winnipeg. It did not include Brandon. So Brandon's always had 6 ICU beds. We're just now adding them into our baseline count, if that makes sense. And I guess now we have 5 vacant beds, or staffed but empty beds. So patients would have been transferred in and out. I think just the ability to have a few extra spaces is always the goal. So technically we have gone over our original capacity, yes. So from 71 to 74 is now our baseline in Winnipeg. And I don't know if patients were transferred to Brandon, but we can look into that.
So the 75 patients that are now in ICU beds right now, are those patients all in Winnipeg?
No.
No, so there are some in Brandon as well.
Yeah, there are, but I'm not sure if that was a transfer direct admit within Brandon.
Okay, and can I ask, what are your other plans, other than obviously stopping non-urgent surgeries, to further increase ICU capacity, and how concerned are you, even with the changes that you're making, about going above what your system can handle as far as ICU care?
Well, I anticipate we are going above. I think we've done a lot of preparation that we can handle going over capacity. To some degree, we go over capacity every year in influenza season. We're not there yet where we were, say, last year around this time. So we have the ability to keep expanding. We have beds throughout the system provincially that we can designate as critical care beds. And the other forgotten group is medicine is also going to expand, more so probably than critical care. So we're looking at where that expansion is going to happen. We have space available. We have the equipment that we need. We will deploy the staff as the volumes start coming in to the hospital. We don't necessarily want to do that prematurely, but we certainly want to have the opportunity to talk with staff and move them when and where it's appropriate, and ensure that they have the training and support so that they feel safe and can manage this change. So I guess the answer to your question is there is space, and I think what we'll have to do is maybe share a little bit more details through the media once we've gone through our process of talking to the clinical leads and the regulatory bodies and the staff, and share that with you so that you have a better idea of the details that are going into the planning.
From the Thompson Citizen, Ian.
Good afternoon, Ian Graham from the Thompson Citizen. Dr. Roussin, the pause added more than 30 cases since Friday. I mean, given that sort of rise, how long would it, if it keeps going like that, would it be likely to get further restrictions in that area?
That certainly is a possibility. We'll continue to watch that. We have a number of our public health approaches ongoing in that area with case identification, contact tracing, isolation. But yeah, in any region, in any area, if we feel that further public health restrictions are required, then we will act on that.
And just, I guess to follow up, I mean, in the north, the code orange came in a week earlier than the other regions, and, it was specified at least for 2 weeks. I mean, what are the odds that it's going to extend longer than that initial 2 weeks?
Yeah, it will be longer. I think that seeing the ongoing transmission in north, seeing the trajectory in the province as a whole, will be required to extend that order.
And my last question is for Lanette. Like right now, I think there's 8 people in hospital from the north. Only one of them's in an ICU, so they're not in the region. But I mean, how many people can be, hospitalized at the hospitals that take COVID patients up here in the PA and Thompson before it starts to put a significant strain on the resources, the number of beds available?
Yeah, that's a really good question. So processes have been set up where physicians and clinical providers in the north, if they need some guidance or any support with internal medicine specialists in Winnipeg, there is a direct line to help them out so that patients can stay closer to home when feasible. But there will be times, for sure, there have been before and there will be again, times where we need to transfer patients down to Winnipeg for more intense, more highly acute care and services. For some patients who may be at risk with chronic disease or because of their age, we actually will bring them down to Winnipeg just so they're closer to a hospital and don't have to fly in a crisis situation. So that's happening too. So really we're trying to look at, definitely we want to work as a province and use all our spaces in terms of hospital capacity, but we also need to look at the needs of the individuals and the risk and get them to the right place at the right time. So it's ongoing dialogue, supporting patients and supporting providers and finding the right space for them, whether that be isolation or hospital or critical care.
Thank you, everyone, and this concludes today's media briefing.
Thank you.